So we talked about curing diabetes. Can you imagine? I mean, curing diabetes? Wow. We've had patients who could not get pregnant, could not have a child because of excess estrogen and polycystic ovary disease, and they were able to conceive and have a baby. We talked to people who couldn't breathe at night and had to breathe through a sleep apnea machine, a CPAP machine, and we've cured them of that. But one of the most exciting things we do is we take patients with severe pain, back pain, hip pain, knee pain, ankle pain, foot pain, and we often either completely resolve it or improve it tremendously and get them off of long-term medications. And so I have 3 stories about that. In our past, we have found that if we don't take people off those medicines ahead of time, their post-operative period can be confused by symptoms of drug withdrawal induced by the anesthetics. And so they will complain of intense abdominal pain even though they don't have much going on in their abdomen. We've actually operated on people unnecessarily to look for something tragic in their abdomen when all they had was withdrawal symptoms from their pain medicine. So now, as you have had, we tell our patients ahead of time, you have to stop all your pain medicine. And I'm going to tell you 3 stories of Lance and Jill and Kathy. Lance was a plumber disabled after 12 back surgeries on high-dose narcotics. He would take handfuls and fistfuls of Percocets. He had no morphine patches. He couldn't work. He was in constant pain. His family life was destroyed. He was completely disabled. He came to us for surgery, and I rejected him. I said, I can't do it with you on all those narcotics. So I told him, stop them all. And he called me names as a plumber might. He knows a lot of words I hadn't heard. But he was tough enough to get off all that pain medicine. He had his surgery, and now he is not taking any narcotics. He's up walking around, and he's much improved. And he says that the surgery has saved his life. Jill is from Portland, and Jill was in a car wreck. She has suffered both legs fractured. She was on high-dose narcotics patches, had a pain specialist giving her narcotics, and we rejected her as well. She called crying on the phone saying, this is awful, and how can you reject me? I need the surgery. And we said, we can't do it with those narcotics. With her pain specialist, she got off the narcotics. She described it as being heck on earth, trying to get rid of all those narcotics. She was in horrible pain. She couldn't walk, but she toughed it out, had surgery with us, and did terrific. Now not taking pain medicine, and brought her son here to have surgery with us, and he has also done well. And finally, Kathy from Arizona came, and she met with me here with her mom and dad. She'd lost her job. She couldn't walk. She had a rod in both legs because of a congenital disease in her legs. She was also on the same kind of high-dose, fistful of narcotics every day. I told her she was rejected. We couldn't do her surgery on those narcotics, and she and her family absolutely broke down in tears in front of me in the consultation room upstairs. And I said, I apologize, but I don't think I can help you, and we may hurt you if you're on all those narcotics. She said, I can't live without the pain medicine. And I said, well, I can't do you on the pain medicine. She was tough enough, and they left here sobbing, but they were tough enough to get off the narcotics. And she has 2 videos, which you can see. She's done tremendous. She's off all her pain medicine. She's been out to fairs and all kinds of things. She's had a wonderful life. What we see is patients come to us devastated by ankle, knee, hip, and back pain. And in many cases, we cure that completely. And in all cases, we've improved it tremendously. So that's what we have scheduled for you tomorrow.
Excited.
It'd be cool.
Sorry, I have to emotional.
No, I understand.
Where's the estrogen?